Welcome back to our YouTube channel. My name is Dr. Vandana Ramanathan. I'm a fertility consultant at Garbhagudi IVF Center, Kalyanagar and Markali branch. Today, I will be giving you a short briefing on what is ovulation induction. We have a lot of patients, lot of couples, and lot of women who actually have put queries on this ovulation induction. What exactly ovulation induction is? What do we do in ovulation induction? Because many a times they are told by their doctors that we'll go ahead with ovulation induction, but they have no idea what it is. So, what exactly is ovulation induction? So, when a couple comes to us, as I have explained in our previous videos, what are the basic evaluations we do? We do all of that, and once we see that a couple is fit for simple treatments where they don't have any major issues, probably the lady is having irregular menses or she's not able to ovulate on time. So in these patients, we do something, a procedure called ovulation induction. Now, ovulation induction is a simple procedure where we give a few medications for the growth of the follicle. We give a few injections for ovulation, and once ovulation happens, then the couple can either have a timed intercourse, or we do a procedure called intrauterine insemination. So basically, ovulation induction is done only when we are thinking of doing simple treatment where couple has no other issues. So what do we exactly do in ovulation induction? We usually do a scan on the second or third day of period whenever the patient comes. If the scan is normal, there are no cysts, or no other abnormalities in the scan, everything is okay, endometrial lining is thin, then we start them on tablets usually. So the first line of treatment is usually just with tablets, where we give tablets for a period of 5 days, some people give for 7 days, a tablet for the growth of the egg. Uh, Now, these are called oral ovulogins, and usually we start with something, a tablet called letrozole or clomiphene citrate. So now that is again which tablet to start for which patient, it again depends on the patient profile. It's not that every patient has to be started on letrozole or every patient on clomiphene citrate, and the dose also varies according to the previous history of the patient, the weight of the patient. If she's had any previous cycles of ovulation induction, whether she has responded with a particular tablet and a particular dose. These are things that we make note of during history taking. So that gives us an idea where as to when we start treatment, how to proceed further. So once the dose is decided and the duration is decided, we will go ahead with giving the tablets. For 5 days, we usually give the tablet, and the patient is called for a follicular monitoring scan on day say 7, 8, 9, again depending on her previous history, or if it's her first cycle, usually on day 9 or 10 we can call her for a scan. Again, in the scan we see how the follicle growth is, if we have to add any medication, see the endometrium lining, how it is forming, and how many follicles are growing. Up to 3 follicles growth is allowed. I mean, it is safer to continue with the procedure if up to 3 follicles are growing. Supposing patient has more response where more than 3 follicles grow, 4, 5, 6. Sometimes in these kind of cases, we do prefer to cancel the cycle. Why? Because we don't have control over the number of follicles that will ovulate. So patient might end up with multiple pregnancies, higher order pregnancies like triplets, quadruplets, quintuplets, which is not at all safe. These are high risk pregnancies and not recommended. So up to 3 follicle growth is allowed. So once we monitor that, we'll again, if the follicle has not completely grown to a proper size, we will call her accordingly. Usually it takes around 10, 12, 14 days, depends on the patient profile, for the follicle to grow to a normal size. When the follicle is around 18 to 20 mm, we give something called a trigger injection. So that trigger injection is again a hormone injection, which usually it is HCG hormone injection, which will help in ovulation. And post ovulation, depending on what the plan is for the patient, either a timed intercourse or an intrauterine insemination is decided. If it is an intrauterine insemination, we usually confirm ovulation post 36 hours and go ahead with the procedure. So these are what is oral ovulations, where we use letrozole or clomiphene citrate for the follicle growth. Now, some patients will not respond well to oral ovulations, where they might not have any follicle growth. Like we see most of the times, this happens with patients who have more, who are on the obese side, or patients with polycystic ovaries might be very resistant to treatment and not respond to oral ovulations. In these cases, we have to use something called gonadotropins. These are injectable ovulagens. So they are gonadotropin, that is hormone injections. Again, now everybody gets scared when we say hormone injections, but you have to understand that the injections that we give are usually the same injections that your body is usually producing every month. It produces it, in a small at a small level, so that only one follicle grows and ovulates for you to get a normal cycle, normal ovulation and normal cycle. Now when we give these hormones externally, they are the same hormones that your body is producing, maybe at a little higher dose, so that your body responds. So many people have doubts that if we use injectable ovulogens, will it affect our body, will it affect our health, will it have long term implications on us? No, it is not going to have any long term implications. These are all short term. It will act only for that period of time. It will help your egg to grow and help for the ovulation. And once the cycle is over, either you get pregnant, or if you don't get pregnant and you get a period, your everything is going to come back to normal. So these injections don't have long term effects. So you can be rest assured that these are safe modalities of treatment. And when we are giving you these oral ovulogens or injectable ovulogens, we are monitoring you by follicular monitoring. We are monitoring whether you're responding, whether you're having a hyper response. So all that is monitored. So you don't have to worry about the consequences, because we will let you know if there is any if the growth is not good, or if there is a hyper response. Your doctor will always let you know and guide you accordingly. So oral ovulogens, injectable ovulogens are simple modalities of treatment which will help. It can help many couples to get pregnant, especially young couples, when all the reports are normal. They many of them click with this kind of simple treatments. So please go ahead and if you have issues with fertility, please visit your doctor, find out if things are okay, whether you can go ahead with this kind of treatment. And don't hesitate, because it does not have any harmful effects in the long run. In fact, it will be beneficial if at all it's required for you. So I hope you have understood about this treatment, and if you have any queries regarding this, please feel free to reach out to us on our website or on the number that is given in the description below. And if you like this video, please share it with your friends and family, and do subscribe to our channel. Thank you very much.